Hi, I'm Steve Best, and I'm here talking with Maribel, and we've been talking a little bit about MNRI, and we want to talk just a little bit about the assessment process and what her experience is, and me as a special education background teacher, my experience of what I've seen. So can you tell us a little bit about your experience of the assessment process?
Well, the assessment process is actually pretty efficient. It lasts for about 30 minutes, in which Dr. Masgutova, she comes and she looks for the different reflexes and the reaction, the action, and I guess like how fast or quick it happens. So you know if the kid is hyper or hypo. But anyways, it's very efficient because you get, in 30 minutes, you get a full diagnosis of how the whole body is doing, you know, these reflexes. But also then you're given like, okay, so this is what's going on, this is the state, this is the where we're at right now, our baseline. And in the conference, we're going to focus on here A, B, C, D. So they tailor the program for you. So this is where the therapist will be focusing. They're going to be teaching you that. And then when you get home, you go home with the program that you implement at home. Yes, it takes time and it's a commitment, but you're given your answers, your questions are answered as to, you know, what are the challenges of my child, but you're also given a course of action. So it's not like, well, your child cannot support, you know, his body with his hands, and then what? So
that is in going to, if you go to another physical therapist or another doctor, whatever, and they're saying, yes, your child can't support their hands, then
that's it. there's nothing else. They're like, oh, the child might benefit from occupational therapy or physical therapy, but then it is up to the therapist to actually decide what will be the course of action, and I don't know how long that's going to take, and it's about you taking your child to somebody else. But here you get all this therapy is done in a course of 4 or 5 days, which is very intensive and it's tailored for your child. And then you go home with the program tailored for your child that you can actually do at home. So it's pretty efficient.
So some of this, can you tell me just a little bit about maybe some of the different specialists you went to get these different diagnoses?
Well, we went, you know, first of all, we went to the pediatrician, you know, and they were like, oh, your child has, you know, you should go through Child Find and see if your child qualifies for therapy. So we went through that route, and yes, he did qualify, and I think it took like 3 or 4 months to get finally somebody at home that would observe a child, like, oh yeah, the child might benefit from occupational therapy or physical therapy, whatever it was. But then trying to identify this therapist, I mean, that was 3 more months. So now we're talking about 6 months that the child didn't receive any intervention. And then we finally, you know, identify one person, and the whole process starts again, because I guess the paperwork doesn't really flow, but it's like, well, my experience, then you're really relying on that particular therapist's background and how updated they are in their studies and what is their philosophy. So you really, to me, I feel like I'm just like going from one person to another, to another, to another, and I don't have a consistent philosophy or a way of thinking as to how we can address this.
So about how many months, or was it that from diagnosis to where you found out about Masgutova and actually were able to come to?
Probably about 2 years. It took about 2 years to actually just go from one diagnosis to another and trying to find different therapies, and we would try one and it just really didn't work out, or we knew that it had to be something about sensory. This is a different approach. So yeah, it took us about 2 years to find. We finally found a good occupational therapist that was aware of Masgutova, and she was like, and she was very honest. She was like, hey, I know what I'm doing is relevant, it's helping your child, but I feel that your child will benefit from this. So she was the one who brought us to Masgutova.
So what would you tell parents that are watching this about they're trying to find something here and they're trying to find any little thing as to how what would you like to have known 3 years ago?
what I would have liked to know that I understand now a lot of the challenges in kids once they don't reach a milestone. For some reason, I felt like I was not a good parent, which is bad. Like my child is not walking properly, or is not doing this, or is not grabbing a spoon. The child definitely has a challenge, has a deficiency, and it's not laziness. And if you try with occupational therapists or other therapists, and it's not mechanical, then it's something before that. And what I have learned from my children is that they're always in the protection mode. So it makes me think that they're like survivors, and that protection mode needs to be addressed. For you to grow, you need to understand your brain, and your body needs to understand that you're safe. And once you understand that, once the brain understands that you're safe, then you can grow. And that's the part that we were missing in all these therapies. We were going to all these therapies, they were very beneficial, but my kids' brains they were not understanding that the kids were safe. I think that's the main thing. Like I really understood that they're survivors. They suffered trauma, whatever, it was in utero or outside, and their system needs to understand that they're safe. They don't need to protect themselves, and they can grow and learn and thrive.
And so what we're going to try to do with this video is, and also we're going to try to do another link of our actual son of doing some spectacular talents that he has that we, that just kind of let us know that there's higher order of intelligence there. We just weren't able to reach it because of that safety mechanism. So keep watching.
Yes.
And please come to a conference or just learn more about this method.